intestine, in which there is a huge amount of digestive enzyme from the pancreas and the gallbladder that's being dumped into the duodenum to help continue to break down that food source. But most importantly, in this neural control, we need to make sure that you guys understand that this is cranial nerve number 10. It is the parasympathetic nervous system. Rest and digest. If we throw you into the sympathetic system, and I won't bang on things so that people who have now fallen asleep wake right back up, but if I throw you into the sympathetic mode, blood gets shuttled away from your intestinal system and transported over to other areas of the body, like the muscle, so that you can run away from whatever danger is chasing you, okay? So when we talk about neural control, make sure that you understand that it's autonomic nervous system. It is parasympathetic in its nature. Vagus nerve or cranial nerve number 10 is controlling it. In the parasympathetic mode, rest and digest. Most of our food gets broken down and then transported along and uptaken for nutrient delivery, okay? Let's talk about specific parts and pieces. So here we go. This is the oral cavity. And I named all the parts and pieces for you: the lips, the tongue, the teeth, hard palate, soft palate, tonsils, and salivary glands. With the tongue, please make sure that you know that it's an unbelievably muscular organ. We'll talk about it here in just a minute. The teeth provide mechanical digestion for us and the breaking apart of that food product. The tongue allows us to be able to move that material around to create the bolus and to adhere the pieces of the material that are being broken down. But let's talk about the hard palate and soft palate real quickly. The hard palate and the soft palate. There we go. So let's, we'll do tongue. We'll finish out with tongue and then we'll do hard palate. We've already talked about the root of the tongue. We've talked about the body of the tongue. Again, very, very muscular organ that allows us to manipulate our food, to continue working on the mechanical and the chemical digestion that is occurring, creating that ball of mush called the bolus. And then that food being able to be pushed into the posterior section of the oral cavity just before it leaves the oral cavity and passes by that uvula. This is the hard palate. So here we go. Hard palate, take your tongue and run it from the back of your teeth up the roof of your mouth. What do you feel? In the lower section, or in the inferior section, you find a very hard bony plate. That is the hard palate. That is the formation of the skull from the interior aspect. It is what is anchoring the teeth. It is called the maxilla. And the maxilla, the extension of the maxilla into this superior aspect of your mouth, is that hard palate. The hard palate is unbelievably important in number one, structure. Number two, function, the ability to kind of contain all that material inside your mouth so that you can create the bolus. But number three, it is a very important protective mechanism for the structures of the brain, because it's creating the floor of the skull to encase or enclose the brain inside. Okay, so we have that hard palate that extends up, protecting the brain. Right there you see brain. So that hard palate. Two plates that come together in fetal formation that should connect together to make one strong enclosed plate. Clinical condition number one for the day. If the two plates during fetal formation that should weave together as one strong plate do not match up, or they are mismatched, your patient will have a condition called cleft palate. And cleft palate, even though we think it's more a visual issue, actually is a very debilitating functional issue, especially for an infant, because they will not be able to create the suction needed for feeding, okay, whether that be with mom or on a bottle. they don't have the hard plate or the hard plate hasn't fully formed, they're actually unable to create the suction that's needed to be able to pull that food product away from either mom or out of a bottle, okay? Cleft palate is a condition that needs to be repaired fairly quickly, and in a number of states, it is a reportable disorder in which moms and dads are required to go ahead and have that surgical procedure done. And most states give you about 18 months to have that repair taken care of, okay? As we work our way posteriorly, run your tongue up the roof of your mouth all the way to the back, you find a very kind of soft area. That's called the soft palate. Okay, now this is more cartilaginous than it is anything. And we don't want it to be hard because some of that food product that's moving through there, as we begin to narrow that area, we want to make sure that there's a little bit of room for expansion and contraction. Okay, food will then begin to move out of the oral cavity. It will have to progress through this structure right here called the uvula. And again, if you look in the back of your oral cavity, there's a little structure that looks like a punching bag. That little punching bag is a flap of tissue that hangs down off of the superior surface of the oral cavity, and it regulates the size of food that can be transported into that esophagus. We don't want things that are too big for the esophagus. So that uvula is there to kind of control the size of the material that's allowed into the pharynx. The uvula, if by some chance something happens where you have to remove the uvula can be removed without too much issue, as long as your patient then understands that they're going to have to regulate what they're putting into the pharynx and the esophagus on their own. Okay. One of the big clinical conditions that we see is ALS. Okay. ALS, also called Lou Gehrig's disease, amyotrophic lateral sclerosing, heavily affected in this area because the motor neurons at the neuromuscular junction have died, and there's no way to stimulate or there is incomplete stimulation of these muscles, and so these patients go through an issue in which they have a hard time swallowing. Again, this clinical condition or the clinical term for swallowing is deglutition. With deglutition, the triggering of the skeletal muscle inside the oral cavity, and then that transition to, because in the oral cavity, skeletal muscle, when we get into the pharynx and into the esophagus, all bets are off. We've lost all voluntary control, and we are now into smooth muscle with the movement of peristalsis. Okay. We also see tonsils. Number 1, palatine tonsils. Number 2, pharyngeal tonsils. And number 3, what we call lingual tonsils. All 3 of them are found underneath. Let's talk about the teeth. Please know the clinical term, dentition. I went to the dentist the other day. Where does the term dentist come from? Dentition means the teeth. It's the study of the teeth. You have to know this term right here. You have to know the term mastication, or the chewing of food. And again, this is mechanical breakdown, allowing the exposure of more surface area to the chemicals that'll be accomplishing chemical breakdown. Okay, here's our tooth. Here's our general tooth. We need to talk about the parts. This will be on the exam, so you'll see 1 to 2 questions about the structure of the tooth. Number 1, anything that sticks up above or out of that cavity is called the crown. So everything that you see above the surface is called the crown. Anything that you see below the surface right here is called the root. Now, you will see heavy-duty blood supply coming in. a very fibrous based material called dentin, and then around the outside, a hard diamond-esque material called enamel that will cause that material to become very, very, very stable and hard, okay? Dentin, that really fibrous material. Now, if I break through this enamel and have destroyed all the material in here and into the dentin, I actually can reach into this area right here, into the pulp or the pulp cavity where the blood supply and nerve supply are. If I do that, I have a cavity. Your patient will say, I have a cavity. For you, it is called a dental carie, C-A-R-R-I-E, carie. Dental caries are cavities, but we need to correctly name them, okay? Also seen in here, within the root, you have what's called cementum, and the cementum actually cements the tooth in. The gingiva is the actual gum that you see, containing large amounts of blood supply and protecting the nerve and the root underneath. Clinical condition, if you have to have this all drilled out and then filled so that we are not, and really the big danger with teeth is called abscess. If you have a dental carie or if you have some kind of tear in the gingiva, it exposes the blood supply to the microorganism that would be harbored there. And the issue with that is if we have microorganisms that are now being given access to the blood system, we may end up with a condition called sepsis. So an abscess is an infection at the site in which blood supply or microorganisms can gain access to blood supply. Once upon a time in the 1960s, before the American Dental Association was formed, the only reason you ever went to a dentist was to have an extraction done because you had an infection or an abscess in that tooth. At one point in time, as many as 40% of people who had abscesses died from them because we didn't have antibiotics, no way to disinfect it, okay? Occlusion, make sure that you know what an occlusion is. The occlusion is when you close your mouth, the way that the teeth sit on top of each, so the way that the top teeth sit on the bottom teeth or the maxillaries sit on top of the mandibles, there should be just a small, slight little gap up underneath. That is called your occlusion. Muscles of mastication, and we've gone through this, but I just wanted to make sure that you get a review because temporalis and masseter were both on our list for the lab. Salivary glands and the saliva that's found there. Hypotonic solution, 90%, 97% water. And it'll have a few other things in it. Number one, amylase. It's an enzyme that breaks down starch. Good question for the exam. Lipase, also ASE, also an enzyme that helps to activate the stomach acid so that when food drops into the stomach, we can begin breaking it down immediately. Number three, mucus. Lots of mucus to lubricate that food. We talked about the lysozymes there to kill the bacteria. We didn't talk about immunoglobulin A. It's an antibody, and we'll talk about antibodies. We've talked about antibodies up to this point. It's a response made by a white blood cell in your body that will inhibit bacterial growth, and then a lot of electrolyte-based materials. Most of the pH is 6.8, might be as high as 7.0, but I would tend to reason that it's down in the 6.8, 6.9 area. This is the esophagus, and again, nothing really happens in the esophagus other than that smooth muscle contraction called peristalsis, taking food from the oral cavity into the pharynx and into the esophagus. Just real quickly so we can see on a visual. When we talk about the pharynx, this is the pharynx. So oral cavity, at the exit of the oral cavity, that's the uvula. So anything in this area is the pharynx. This is the nasopharynx leading directly into the nose. So nasopharynx, oropharynx, oropharynx, and then what we call the laryngopharynx. Ooh, it looks like my battery's starting to. I do want to show you this structure right here, and we'll show it to you again. This guy right here is called the epiglottis. And the epiglottis is that trapdoor that covers over the trachea. And there you see the rings of the trachea, covering over the trachea, preventing food from going down into that trachea. If food does go down into the trachea, we have a condition called aspiration. And your patient will allow food down into that trachea, which when food gets into the trachea and down into the lung, we run a very big risk of infection, okay? Let's talk about the stomach and the four parts of it. You have to know the four parts of the stomach, okay, hands down. Divided into four regions. Number one, the cardiac region. It's called the cardia. And it's found right where that, what they call the lesser curvature is. And they call it the cardiac region because it's sitting right near the heart. And the heart, the extension and the apex of the heart kind of shape or help to mold the shape of the stomach. Number two is called the fundic region or the fundus. And the fundus is the most superior aspect. And it tends to have a lot of gas that gets trapped into that fundus. It doesn't really break down anything. It just basically traps the gas that is created by the stomach. And then, if it has to be released, can be released back up. And your patient will call it burping. And off the top of my head, I've just lost the clinical term. I will remember it before we get out of this discussion, okay? The body, which is the major portion that contains all of the cells, and we're going to talk about the cells here in just a minute, but the body is where we'll find all of the major cell types, 4 cell types.